I mean, the patient who passed last night, I just knew he had a girlfriend. I never even heard his voice.
That was hard. Brutal. Brutal.
My name is Melanie. I'm a registered nurse. I work at the Ottawa Hospital at the general campus in the intensive care unit there. So when I heard about the pandemic and when I heard about COVID-19, I guess I'm not gonna lie, I definitely sort of had that attitude in the back of my mind, which is probably wrong, that like this can't happen to us. And then when we received our first case back in March and we started to get information from management about surge plans and how the ICU would be run if it did start to look like Italy, it was a terrifying idea in my head. But I think just like any of us, we just sort of, this is the unknown and we're trained to do this and we're gonna just have to adjust and adapt as what happens, happens. I find going into work one of the most difficult things to do because you're going into work into the unknown, exactly into the unknown. You have no idea how many patients are in your ICU. Are they ICU patients or are they patients that there's just no more room for them elsewhere that you have to provide care for? So when you see cases going up in the city, you are very much concerned that that's happening. If the cases are going up in the city, then that means they're going up in the hospital, and then that means that I have more patients to take care of. And I hope we never get to a point where we have to decide which patients we're taking care of. COVID-19 has changed my job in many ways. And I feel like the best way to describe it is the barriers that it's created. It was very intimidating the first time to walk through to the COVID side doors. There's these big signs on the doors that say, stop, do not enter. Even being a bedside nurse, because of all the aerosol generating procedures, now our ICU room doors were closed. So suddenly just yelling out for help wasn't as simple. You'd have to stop what you were doing or open a door, or suddenly our call bell, the call bell for the patient became our call bell to get someone to come help us. I think more than anything, it's changed patient experience. You're using iPads to call their family, and sometimes they're seniors and they have no idea how to run an iPad, and then you spend an hour on the phone trying to explain to them how you're gonna call them just so that they can lay eyes on their loved ones. It's hard for someone to grasp exactly what's going on when they can't see it. A picture is worth 1,000 words and they don't have that picture. For the physical care, it hasn't changed much because I'm still gonna do my job and provide the best care I can to you. But the aspect of social and family care and how they have emotional support. So we provide way more emotional support to patients than we ever have before. I feel like touch is something I never really focused on before, but now it is. They just take their hand, I'm here. I think something that impacts me a lot is I don't know who that person is. So yeah, I'm holding their hand as they pass away, or I'm sitting there with them as they take their last breath, but I have no idea who they were. I honor them as a person, as a loved one, and as an individual, as a person who had a place on this earth, but I don't know who they were. I don't know who their loved ones were. Before, patients' families would bring in pictures, and so you could see what the patient looked like. And they would tell you stories about the patient, and so that you could get a feel for who they were as a person before they got sick and couldn't communicate with you. But now these patients are alone. The people that they've spent a majority of their life with can't be there, or if they choose to be there, they have to go home and isolate for their 2 weeks. They're very isolated. It's very lonely. It's lonely for everybody. It's hard. I've seen it really bother some staff, especially newer staff. because it's easier when family's there. It's easier. You know that if they're going to be okay. You know, like you're not talking to them over a phone and you're telling them that their loved one's passed away. And you hang up, you're like, oh my gosh, are they going to be okay? Are they, like, is there someone else there for them? At least before COVID, there was at least 2 people who would come in and they had each other. But now if I call someone and they just have a partner alone at home, you go, I hope they're okay. I hope that someone's there to check on them. I can ask you if you're okay over the phone. Even a hug. If someone passes away in the ICU before COVID, I mean, you'd hug them. Or, you know, you'd be able to look at them in the eye and tell them you're sorry. But now, lots of times they're alone. And I've never even heard their voice. The first thing I'm gonna do when this is all done, hug my grandmother. I'm gonna cry. Sorry. Yeah. I'm lucky because I still see my parents. And my grandma. We see from afar. When it's a warm winter day, we'll go over and she'll sit outside with us so we can see her. But yeah, hug my grandma. And I think my message to Ottawa residents or surrounding residents or to anybody is just to celebrate the small victories. To celebrate all victories. Whether it be you're watching the case counts and they went down and today that's your victory, or try and find a little bit of positivity in every day. It's not all negative. We're doing the best we can as each person, and just celebrate any victory, big or small.